This is your popular radio, Voice of Naija, transmitting today on 102.2 megahertz ether and 103.8 cable. I repeat, we are transmitting on 105.2 megahertz ether and 103.8 cable. You may tune in to watch us through the Ustream, or you can play it back on www.salto.nl. You click on Monday from 06 hours to 10 o'clock, and you will get exactly this particular broadcast. Today we are bringing to you something very, very special, and don't forget, it is going to help you, it's going to upgrade you, and it's going to make you to be somebody who will live a very sound health. Our guest today in our health segment is no other person but Professor Dr. J.J.M.C.H. de la Rosa. So listeners, wherever you are, tune in and let's zoom off. Once again, give me the permission to say a little about our guest today. Professor Dr. J.J.M.C.H. de la Rosa is here to discuss on kidney stones. He is the professor and chairman of the Department of Urology at AMC University Hospital in Amsterdam, the Netherlands. He completed his medical degree and urology residence at St. Radboud University Hospital in Nijmegen. He subsequently was appointed consultant urologist and director minimal invasive urology at the Department of Urology at St. Radboud University Hospital in Nijmegen. Dr. de la Rosette is the chairman of the Committee on Minimal Invasive Treatment of Benign Prostatic Hyperplasia, popularly called BPH, of the International Consultation on BPH. Permit me if you don't understand me, because he's going to say more about himself later on. He's also the chairman of the Committee on Renal Stone Disease of the International Consultation on Stone Diseases. Both consultations are patronized by the World Health Organization, who he is past chairman of the European Society of Urotechnology and board member of the Society of Andrology. Professor de la Rosette was chairman of the European Association of Urology Working Party on BPH guidelines from 1996 until 2004. Dr. de la Rosette is author of 300 peer-reviewed publications and has authored many book chapters. He is the editor of books in the field of laparoscopy, renal carcinoma, prostate disease, urological imaging, and voiding dysfunction. Welcome to our radio Voice of Naija show, Professor Dr. de la Rosette. Welcome.
Thank you very much, and I must say I'm impressed by my wonderful CV. But what you learn from this is that I've been focusing a lot on two conditions, which is voiding complaints of males and stones.
Okay.
Now, in our field, urology is a big field. We call this the butter and bread of our daily life.
Okay.
Because a lot of patients have end stones and prostate problems.
Yeah.
So it's nice that you come here to discuss about one of them, stones.
Well, kidney stones are solid stone-like lumps that form within the kidneys. They can be as small as a grain of sand or as large as the size of a golf ball, sometimes even larger. Most stones are less than a third of an inch in diameter. The stones are actually accumulations of mineral salts and other substances. Similar stones are also can form in most other portions of the urinary tract. Many of these stones are small enough to pass out of the body during urination, but some larger stones may partially or fully block the normal flow of urine. Kidney stones can cause intense pain and other symptoms. Now, our first question to you, Professor, is what would you please tell our listeners, or would you please tell our listeners in a more simple way, what are kidney stones?
Well, kidney stones are stones in the kidney. It's that simple. Now, how do you make kidney stones is one question.
Yeah.
And the second one is even more important. How do you get rid of them?
Yes, we will be getting back to that.
How do you make them? Well, all of us potentially can make stones. And why? Because in the urine, when we go to the toilet, it's actually water with very, very small particles of stones. Now, in certain people, these small particles stick to each other and become a bigger stone.
Yeah.
It's like sand. You have small pieces of sand, you just can pee them. But if they become bigger, it's like a real piece of stone. And when you cannot pee it out, it remains in your kidney. And then you've got a kidney stone.
Yeah, but Professor, permit me to ask this question. What are the symptoms of kidney stone?
The pain. Well, terrible pain. So you're sitting in your chair, comfortable, having a drink, reading a book, or listening to your radio program, and then suddenly you feel a pain in your flank. And it aches. It comes like in waves.
Yes.
And it's indulgent, and it becomes more and more, and suddenly you are in agony. You feel terrible.
Yes.
You cannot listen anymore to your wonderful program. You have to go and move. You want to shake. You want to get rid of it.
Yeah.
And the first thing you say, please, somebody, help me. I want to get rid of this.
Really?
Yeah.
So it's so intense like that?
Absolutely. I personally have kidney stones, and when I have them, I go down on my knees and pray to God to get rid of them.
You're a
Really?
doctor?
Yes,
You're
definitely.
a specialist of this?
In stones, and I'm also a patient with kidney stones.
So, are kidney stones hereditary?
Not. It can be, yes. You have certain forms of stones that you say, my father had them, my brother had them, I have them. But that's in rare cases. But if you look at this, about 5% of the population in the Netherlands has stones.
Oh.
But if you come from Ghana, Gambia, Nigeria, your chance is about 10 to 15%. Why? One of the things is it's hotter.
Yeah.
You make more easily, you drink maybe less, and you have more stones that easily form in the kidney. So heat is one. The second thing is the food. You have in certain countries, and most of them are in the Mediterranean area, where it's hot, they eat a lot of salty meat, they eat a lot of, for example, peanuts with salt in it, and they also cause at a higher rate stones. So both the food, when you eat a lot of meat, for example, or you drink not enough, or you're living in a very warm environment, you have a higher risk of stones.
So what you are saying to our listeners out there is that kidney stones can be affected because of the climate.
Exactly.
Where the climate is hot,
yes,
then there's likelihood that people can have kidney stones.
Exactly. So 15%, that's 1 out of 7. That's a high number.
Yeah, it is.
It's a high number, yes.
So if that is the case, so why are they still having kidney stones here in the Netherlands?
Why we still have them?
Yeah.
Because those who have the stones, they continue making them. So that is, for a businessman, the best there is. You have a stone, you take it out, and you make a new one. To prevent formation of new stones, that is difficult. There is at the moment not really a medication, a pill that will prevent the stones. One of the things that helps is, of course, drinking enough.
Drinking enough.
And I don't mean alcohol.
Yeah, water.
I mean water.
Yeah.
You should drink enough, and that dilutes the stones, that makes them flush out more easily. So I recommend that when somebody is living in a warm country, stays in the Netherlands where he's living, goes to his country for a holiday for 6 weeks, 8 weeks, I tell him, drink enough. Because you might be 5% here making stones, but when you go back to Nigeria, you are certainly at the 15% risk. Because you don't drink enough, it's hotter, and then you make stones as a gift on your holidays?
Well, somebody out there, you can see this is our health segment with the Professor de la Rosette, or the head of Department of Urology, AMC. We are talking on kidney stones today, and you are hearing him clearly saying how the geographical location can affect, or the weather can affect the making of stones. So please give us a call on 023-681-968. This is coming to you on the radio waves of Radio Voice of Naija, transmitting on 105.2 megahertz, 103.8 cable on Radio Razo. Stay tuned.